Hey guys, today I'm going to be showing you a little exercise you can do at home that's really good for low back pain, especially new and recent disc herniations. It is an extension exercise. This is mainly for the people who have a lot of pain bending forward in the position I'm in here now. So this is something you can try at home at first to see if it's comfortable, and if it is, we can continue to do this exercise and I'll show you how. So I'm showing you on the bench today, but you can do this anywhere, typically on the floor. So you're going to lay on your stomach. If you're on the floor, it's going to be nowhere to put your arms down. So you're going to be right underneath your chest like this. And for some people in severe pain, this is enough. But what we're going to be doing is an extension. So you're going to leave the legs flat and you're going to push up away from your forearms into a Sphinx posture. Now you're not trying to really arch the back and tilt the pelvis or lift the legs up. Just push yourself away from your forearms, just to your comfort. If you're getting sharp stabbing pain, we're going to stop this. Come on back to the office in your next appointment. We'll talk about something that's better for you. But for those people who have trouble going forward, this is most likely going to feel better. So this extension exercise, you're going to hold this anywhere from 30 seconds to a minute, and then you're going to go back down for about 10 to 20 seconds, and then you can come back up again into that extension, 30 seconds to a minute, and you're going to repeat that. It's like a workout. So you're going to do 8 to 10 reps of that, and then you can do anywhere from 3 to 4 sets. So you can do this ultimately for about 5 minutes, which is really going to help you out. Before you get right up, if we're in severe pain, either roll to your side or spend a few minutes just resting on the forearms until we're able to roll to your side and get up that way. Okay? If you have any questions, feel free to let us know.